In Module 1 of this e-learning course about integrating the U=U message into clinical practice, we reviewed the evidence underpinning HIV treatment as prevention. Module 2 offered video testimonials from people living with HIV about what U=U has meant to them. This final module wraps up this e-learning activity by offering guidance regarding how to communicate U=U to people living with HIV at various stages of their clinical experience. Clinicians have an opportunity to help destigmatize HIV at the first two stages of the HIV care continuum. The first stage is when an individual gets tested, receives an HIV-positive diagnosis, and is linked to HIV care. The second stage is upon the initiation of antiretroviral therapy, or ART. Dr. Deborah Benneter, an HIV treating clinician at the George Washington University Hospital in Washington, D.C., offers this simulation.
So it's so good to see you. How are you doing?
I'm doing good.
You're now about 6 weeks in on the antiretrovirals.
Yes, I am.
And how do you feel?
I feel great. I take my pills every day like I should, and I don't have any side effects.
Outstanding, wonderful. And I have wonderful news for you. Your virus was undetectable. And so that's fantastic news. And looking forward, what we hope for is that your virus is undetectable forever.
Effectively communicating the U=U message shortly after an HIV-positive diagnosis can support the initiation of ART, as well as promote the need for optimal adherence to treatment. But there is a second opportunity to leverage the U=U message. When a person living with HIV achieves sustained viral suppression, it is important to communicate the importance of adherence to maintain that suppressed viral load. Here, again, Dr. Benneter simulates communicating about U=U to a patient who has achieved viral suppression.
It's wonderful to see you.
It's nice to see you too again.
How are you doing?
I'm doing well today.
And how are you doing over the year?
Since I started this drug, I've been adhering very well. I've got a friend that keeps me on my toes and
Excellent.
keeps me accountable to taking the drug every day.
Excellent, excellent. So important.
I agree.
So I also have wonderful news for you. Your virus remains undetectable. So since you started medicines and had your first labs at about a month, to the present day, almost a year later, your virus has remained undetectable.
It's good news.
That's fantastic. And so what we hope for you is to remain on the medicines without interruption and that your virus remains undetectable. And that allows your immune system to be the strongest it can be, for your health to be as good as it can be, and for you to live long and well. So we hope for that for you. The other side that's really important is something called U=U. Have you heard of that?
I have not.
So U=U is undetectable equals untransmittable. So probably for about 10 years, we've had some anecdotal data and some small clinical trial data that if your virus is suppressed, that you can't transmit HIV to your sexual partner. Particularly in the last couple of years, we have increasing confidence that there's no risk of transmitting HIV to a sexual partner if your virus is durably suppressed. So 6 months and beyond of viral suppression.
That's good news.
It's fantastic, important news. There is another side to that, which is important, which is that there has been an increase in the rates of sexually transmitted infections. So chlamydia, gonorrhea, syphilis, even hepatitis C. And so caution is still important when your partner's STI status is unknown, and protection remains important in that setting. On the other hand, as you look forward, it's important to know that by taking the medicine every day and staying virologically suppressed, that you're not at risk of transmitting HIV to your partner, to a loved one.
That's better for my peace of mind.
So important for your peace of mind. I'm so happy that it's possible to share that news.
I'm very happy to hear it. Thank you so much.
Clinicians can effectively communicate the U equals U message to people living with HIV at 3 stages across the HIV care continuum. These include at diagnosis, when ART is prescribed, and when viral suppression is achieved. In doing so, you can destigmatize an HIV diagnosis, drive demand for ART, and promote treatment adherence. Your efforts to integrate U equals U into clinical practice can also assist with global efforts to end AIDS as a public health threat. IAPAC encourages you to integrate U equals U into your clinical practice today.